May I have a motion, please?
So moved.
I have a motion by Commissioner Murillo. Do I have a second? I'll second the motion. This is agenda item number 12, resolution amending resolution number 2018-47, Healthcare Assistant Program Criteria and Procedures. Ms. Michael, good afternoon. How are you?
I'm well, thank you. Good afternoon. Jamie Michael, County's Health and Human Services Department, and with me is also Norberto Godina, who is our manager. He and his team oversee the county's healthcare assistance program. He also serves as the Association of Counties Chair of the Health Services affiliate. And we are here today seeking some amendments to county resolution that sets the criteria and procedures for the county's healthcare assistance program. So just a couple level setting statements. The county's healthcare assistance program is governed and directed by state statute, and it is not health insurance. So it is not intended to provide people with full comprehensive coverage. It is intended to help people who are able to meet all of their regular bills and able to, through their income and assets, are able to manage paying bills. But because of an unforeseen healthcare issue, they may have additional healthcare costs that are a burden a financial burden for the individual or family. So that's the intent. And we do work hand in hand with the New Mexico Medicaid program, because that really is the program intended to give people full comprehensive insurance and cover all of the gaps. So we are asking for 6 amendments or changes to the resolution, and you have a summary of those in the executive summary, as well as the current resolution with the changes, like a red line version with the changes indicated on that resolution. So the first 2 are really just administrative changes. One is to update the language in the resolution to be consistent with the state statute. So we just added the statement there. And the other one is to be consistent with the changes that were made to the Patient Protection and Affordable Care Act. So those 2 changes are primarily administrative changes. And then the third change that we're looking at was based on a conversation with the New Mexico Center for Law and Poverty, and really looking at how do we make the criteria as clear as possible when it relates to sensitive information such as immigration status. So the way the county's healthcare assistance program is set up, as it's mandated by the state statute, is we are the payer of last resort. So if someone qualifies for, is eligible for, or can get coverage from any other source, they have to go to those other sources first. This is for people who do not qualify or are not eligible for other coverage. And the Affordable Care Act lays out hardship exemptions, other exemptions, and exclusions. So those are circumstances when an individual does not qualify for Medicaid and cannot purchase insurance on the exchange. So that proves that we are the payer of last resort. And one of the exclusions from the health exchange or other coverage is related to immigration status. So we've made some changes to that language just to make it more clear that it's not excluding people from the county's healthcare assistance program. In fact, it's a way for them to qualify for the county's healthcare assistance program. So I think I will stop there and see if there are any questions about that change, just because that one is a more substantive change.
Thank you, Ms. Michaels. Commissioners, any questions to this point? No questions, no comments.
Wonderful.
Please proceed.
Thank you. I will move on to the 4th change, which is related to the types of service that the healthcare assistance program will include. And what we are doing here is basically several years ago, our department went through a needs assessment. We asked community members what are priorities related to health and human services. And that is what has driven how we spend our healthcare and indigent dollars. So primary care, dental care, and behavioral health, along with end of life and physical therapy, were priorities that were the result of that planning process. So for the past, I think, probably 10 to 14 years, we've been funding and including those services with the healthcare assistance program. So I just wanted the resolution to clearly identify those services that we're already covering. In addition, I have added long COVID treatment because we know now that many people are experiencing side effects related to long COVID, and many of those side effects impact their ability to work, to go to school, to participate in daily activities. And we also know that there are some fairly simple therapies and rehab services that can help people overcome that. So we would like the option to include long COVID as one of the services that we can go out and contract for and cover if someone needs those types of services and qualifies for the program. So again, I'll stop there. Any questions about the changes to the types of services?
Any questions, commissioners? No questions. Please proceed, Ms. Michaels.
Thank you. The next change is to the cap, the dollar amount that we will cap the program. So an individual within the fiscal year, current resolution says there is a cumulative cap per individual of $25,000, and we are asking to increase that to $5,000. It has not been increased in well over 10 years, and so we just think it's prudent to take a look at the cap that we're including in, and this is directly related to reimbursement of claims that hospitals that are out of the county send us. 50. So we're asking to go from 25 and increase it to 50. Thank you.
Any questions, commissioners? Commissioner Reynolds.
I do have a question about that. Thank you, Madam Chair. So what pool does this money come out of? Does it come out of money that's already given to us and we have a limit? Or, so let's say we get 10, we got, does that say 50,000? Let's say we get $10 million in indigent funds. When we run out of those at $50,000 a piece, do we stop providing the reimbursement? Or do we have other funds available to us?
Madam Chair, Commissioner Reynolds, the way the state statute reads is the county commission gets to allocate the amount of money each year, and regardless of this cap, once that budgeted amount is out, then we would stop providing any kind of reimbursement. But we have not had that circumstance since I've been in the position. But we would stop reimbursing for services if we run out of money.
Okay, and that's what I'm trying to clarify, yeah. Is if we run out of money, what do we do?
Correct. The commission could choose to change the budget each year and increase it. So if I come to you in February saying we're out of funds, we don't have any more funds in the budget to cover healthcare assistance services, you all could choose to increase the budget. Okay. But the decision for how much is allocated for this program each year lies with the county commission.
Okay, now isn't this also based on a grant that we get from the state to cover this? Or is this money that we basically just put in our budget?
Madam Chair, Commissioner Reynolds, this is all county gross receipts tax. There is no state funding. In fact, we have to send a good portion of what we collect in this GRT to the state to support the Medicaid program and the safety net care pool.
Okay, I was aware of that. Yeah, just said, okay. I wanted to try and understand the total picture on the financing. So if we got halfway through the year and we ran out of money and we had a desperate need because of a lot of, let's say, long COVID or some sort of crisis, we could actually address that by allocating additional funds to this program. That's what you're saying?
Yes, Madam Chair, Commissioner Reynolds, the commission can do that at any point, absolutely.
Thank you very much. Thank Thank you, Madam Chair.
Thank you, Commissioner Reynolds. Any other questions or comments?
Madam Chair.
Vice Chair Sheljo Hernandez.
Ms. Michael, is there any ARPA funding left that we have put aside prior commission into something like this? Wasn't there like $1 million or $1.5 million? What is the status of that money and where are we using it exactly?
So, Madam Chair, Commissioner Sheljo Hernandez, when it was initially allocated, it was for hospital bills related to the treatment of COVID. And at that point, it was clear that state and federal money was already reimbursing for that acute treatment of the COVID diagnosis. So now that we have a little perspective and we've been able to see the consequence of COVID, primarily long COVID, that's why we're asking to include this. And there is still $1 million allocated in the ARPA funds that if we go out to procure this service, that would be included. So we would use those funds first.
So, okay, perfect. So we're going to use the ARPA money before we dip into the money that we allocated in the budget for this type of service.
Yes, correct.
Okay, perfect. Thank you.
Thank you, Vice Chair Sheljo Hernandez. Any other questions, Commissioners?
All right, thank you, Madam Chair. The last change is, in addition to reimbursing out-of-county hospital claims, we also included in here reimbursing cancer treatment, and including that same criteria. People will have to qualify for the program, and we've also included the same annual cumulative gap of $50,000 per year. And we've also said that treatment that we contract for, the cancer treatment that we contract for, will not exceed the New Mexico Medicaid rate for any reimbursement.
Questions, Commissioners? Comments?
Just a quick question. So for reimbursement, it would be within the fiscal year that we would be reimbursing, or how far back do we go for that?
So would we reimburse claims through this process? It is within the fiscal year.
Okay, perfect. Thank you.
Mm-hmm.
Thank you, Vice Chair Sheljo Hernandez. Any other questions or comments? Anything else, Ms. Michaels?
No, that's all. Thank you, Madam Chair.
Is there any other member of the public that'd like to approach the podium and address the commission? Ms. Diaz, would you please identify yourself and remember you have 3 minutes?
Good afternoon. It's not morning anymore. Madam Chair, County Commissioners, County Manager, staff, and public. My name is Yoli Diaz, Executive Director of Cancer Aid Resource and Education. I would like to begin by saying thank you for amending Doña Ana County's Healthcare Assistance Program. You can't have quality of life if you can't access healthcare. As you know, I've been advocating for access to healthcare, including cancer treatment, for some time now. I also want to say thank you for including the section of cancer treatment coverage in the county's healthcare assistance program, since this was a gap of healthcare service to the most vulnerable population of Doña Ana County. I believe that this is a good faith effort on behalf of the Board of County Commissioners. On a positive note, I believe that Doña Ana County has now taken a 180-degree turn, and that it has set precedents with adding cancer treatment, which was needed to provide a solution to some health disparities and inequities. For this, I am very grateful. Regarding the resolution, I would like you to consider the input of possibly 2 items. 1, the major of the gaps in healthcare services is diagnostic testing. I would like to see that this language is added. Some of the residents I have assisted have included that residents have issues in receiving diagnostic testing and that they are uninsured. Please consider that treatment works best when cancer is detected early. Detection of some cancers at an early stage combined with prompt treatment permits less aggressive treatment, leading to a better quality of life of the patient, and is associated with significantly reduced mortality. 2, on item 2, the process section E, if it doesn't cover this, please consider another item. Another issue I have seen is that some residents have long waits in getting appointments. I believe that the consideration for any provider that provides both diagnostic testing and cancer treatment needs to be considered. The true reason some residents have not accessed the care they need when they need it is due to being uninsured, underinsured, the cost, whether not being able to pay at all or not being able to pay the high cost of the estimate. In other words, unaffordable. Thus, the first barrier of cost is solved in the resolution. That's the big one. Prompt treatment may involve the consideration of any provider that can provide the treatment and be paid the Medicaid rate, because at the end of the day, we're talking about the same cost. I still believe that there's work to be done. My concerns include the knowledge of this problem in accessing health care in the first place. In 2011, there was a community-wide effort in Doña Ana County to discuss the challenges in implementing the Affordable Care Act in Doña Ana County. I can't keep talking. I thought if it was an item, I could say it.
3 minutes.
Really? I thought it was going to be allowed more because I have a heck of a lot more to say. Do I have to continue this?
Ms. Diaz, I'm happy to meet with you outside of the commission meeting and discuss some of your recommendations.
Okay, I'd be happy with that, but I'd also like the commissioners to know. So what I can do is probably, because I do want this to be public, because I think it's very important, especially with the other issues that we do have, because there's still issues within the lease. And I really want you all to hear what I have to say. So I will continue it. I'm happy to meet with anyone to be able to improve health outcomes in Doña Ana County.
Thank you, Ms.
Thank you.
Appreciate your time. Commissioners, any other questions or comments? I do have a comment, and I need to thank Ms. Michaels and her staff, because I think this is an important step to the county moving forward. Is it a perfect plan? No. Is it an excellent plan at this time? Yes. And we do it little by little, working together, listening to the public, and coming before this commission and having thoughtful and well-rounded conversations. So, Ms. Michael, to you and your department, great job. Thank you. Anything else, Commissioner Reynolds?
Thank you, Madam Chair. Ms. Michaels, there's the comment that Ms. Diaz said about adding diagnostic testing to this. I actually think that may have some merit. What are your thoughts?
Madam Chair, Commissioner Reynolds, it is difficult to prioritize the type of healthcare services that people may need. When I talk to emergency department staff, they say dialysis is the top of the list. When you talk to, it depends who you talk to. There are so many unmet needs in our community that we really are in a position where we have to use our resources the best we can and unfortunately prioritize. So my recommendation would be to let's give this some time to see how many people are in need of cancer care and how much that is going to cost the program, and then look at what ability we have to add different services over time. We also, through the relationship with Memorial Medical Center, they do cover quite a few diagnostic testing. We do reimburse the federally qualified healthcare centers for primary care, and that can include some testing. We also, I will confirm with the New Mexico Department of Health, because they've had programs in the past for specific types of cancer screening. So I think learning more about what is already available first before we add a longer list of services. We're already spending over $10 million for the healthcare assistance program each year, and at some point we do have to prioritize. The other thing I would say is, I think our greatest, so to meet all of these gaps, I think the greatest thing we can do to help people is to help them get back on Medicaid or purchase insurance on the exchange, because then they do have comprehensive coverage. This program is never going to be comprehensive and meet everyone's needs. But if we can get people on Medicaid or get people insured through the exchange, then they will have comprehensive care.
Yeah, thank you. This makes me think about something else that I should have thought about, and I have thought about, just not till now, about how extensive it could be. Is it possible that you could actually prepare a presentation for us, giving us a kind of a breakdown of how the medical situation is today? I mean, i.e., how many, I know the percentage of people who have diabetes is like in the 50% or something like that or better in ages. Is there some way you could do a presentation to prepare us to understand a better, clearer picture about what the challenges are in healthcare in the county and what the, I know what the resources we have, the resources being used. You might want to do it with another organization, I don't know, LC3 or something, but it'd be nice to have a one meeting where we can actually say, this is kind of the state of healthcare in the county. This is what the city does. This is what the county does. This is what the state does. This is what the federal government does. And then help us to understand ways that we could possibly increase our ability to do a good job of mapping out the coverage. And as you said, use our resources wisely, to cover the most important things. And I'm not sure that I'm educated enough in this area to make really good decisions or even make good recommendations without your advice, Yoli's advice, and other people in the community. So I'd love to have a half an hour presentation on exactly what that profile looks like for the county today.
And if I just may, Commissioner Reynolds, because I don't think I understood perfectly, are you asking for a presentation based on the top 10 medical issues or across board? I'm not understanding.
Thank you, Madam Chair.
And I apologize.
No, that's a fair question. Because when I think about...
Because there's so many diseases out there.
Exactly,
I'm just thinking what you're requesting Ms. Michaels to do. And
when I think of the community, I mean, there's a couple of things that we can look at and go, yes, that's a problem. Diabetes is one of them. It's hard to ignore that. Kidney disease is one of the things that actually is caused by diabetes. And then, so we look at the root cause of the problem, which is diabetes, and then how do we actually test for diabetes? Well, we do an A1C test. And if you can test for diabetes and get your A1C under control, then generally we don't go down that route. So I guess that's the kind of profile I'm looking for is what are the top 10, maybe what are the top 20, whatever, where's the money going, basically? Where are the resources going? Where are the resources needed? Okay, basically where they're needed, where they're going. And let's deal with what is the prevailing challenges that we have so we can see those. If they should fall in the top 10 or top 15. But there may be some minuscule thing out there that only happens in Doña Ana County, like uranium poisoning or something, okay? Because we know that's all over the place here. So if there's something that is unusual, then yes, we talk about that, even though it may not be in the top 10, but it may be prevalent just in this area. So yeah, I would like to have a presentation on that so to prepare us for these kind of discussions where we can participate more intelligently. Okay?
So
knowledge, we maybe not intelligently because intelligence and knowledge are not the same thing, maybe more knowledgeably anyway.
right, so the top 10 health issues in the county?
Yeah.
Okay.
And kind of profile that for us.
So,
Thank you.
Madam Chair, thank you for the clarification. Commissioner Reynolds, we do have primary data, which is data that we collect directly from the healthcare providers for the population of people who are served under the healthcare assistance program. So there is, I think, about 5,000 people enrolled in the program, and Norberto's data can tell you why they go to the doctor, why they seek primary care, dental care, or behavioral health. So we can give you that primary data that describes the demographics of the population. So the 5,000 people, we can tell you most are men, most are this age. We can give you that type of information, which I think is, because that's the subset of the population that this program is trying to serve. The healthcare assistance program isn't serving the entire population, but we do have a state of health report that we produce with the local health council. And that does give, I think it gives the top 5 morbidity and mortality. And it also looks at health equity. So it looks by zip code where are the greatest years of life lost in our community. So if I can start by sharing that report with you, both the county's healthcare assistance program report and that state of health report, and maybe from there you can give me some direction on what you would like to see, or maybe the information in those two reports will answer your questions.
Thank you.
Does that suffice, Commissioner
Well,
Reynolds?
I was going to say that the
To
only
begin
thing.
with?
I'm sorry?
To begin with?
Well, the only thing that's missing from that is actually where the money comes to pay for those services. And I think that's also something that what resources do we use and what do we allocate? What does the state government provide services for? What does the federal government provide services for? And what are the gaps in that? So I think if you took what you're talking about there, you map that over the resources that are available to treat those and deal with those situations, I think that would be the picture I'd be looking for, is to take it one step further so I understand financially what kind of burden it is on the county and other resources that we have in the community. I think that would kind of complete the picture. Okay? Thank you.
Thank you.
Thank you, Commissioner Reynolds. Any other questions, commissioners? Thank you. May I have a roll call vote, please?
Commissioner Murillo,
Yes.
Commissioner Reynolds,
Yes.
Commissioner Sanchez,
Yes.
Vice Chair Shaljo Hernandez,
Yes.
Chair Chaparro.
Yes, motion carries unanimously.
This item does have a resolution number. That resolution number is 2023-67.
Thank you, Brandy. We'll move now on to agenda item number 13.